Knock, knock.
Oh, hi.
Hello there. My name is Jonathan. I'm going to be your nurse today, okay?
Mm-hmm.
I'm going to draw this blank to give you some privacy. I'm going to wash my hands and do some hand hygiene, okay?
Mm-hmm.
Is it okay if I sit right here with you?
Sure.
Okay. All right. Can you tell me your name and date of birth?
Priscilla Sexton, February 7th, 1997.
All right. And what brings you in today?
I'm here for my wellness check.
Okay. When was your last one?
A little over a year ago.
Okay. Was it with us or someone else?
Somewhere else.
Okay. Well, I guess we'll just go ahead and get started. Just tell me about some of your past medical history.
I don't really have anything going on. I got some anxiety, I guess, but that's about it.
How long have you had some anxiety?
I got actually diagnosed maybe in 2012,
Okay.
but I probably had it longer than that.
Okay. You taking any medications for it?
Not currently.
Have you taken any medications for
I
it?
took Buspar for a while and then it didn't work for me.
Okay. What are some of the symptoms with your anxiety? Do you know what causes it?
No, not really. I just feel like it's just anything. I don't really have to have anything, I guess. But I'll get like jittery, shaky.
Okay.
I don't know. That's about it, I guess.
Okay. Any other kind of health problems?
Mm-mm.
What about when you were a child?
Not that I can think of off the top of my head. I had ear infections a lot.
Some ear infections? Did you ever have to get tubes in your ears?
Mm-mm.
Okay. Have you had any major adult illnesses since growing up?
Mm-mm.
Okay. Are you up to date on your immunizations? Did you get your flu shot this year?
Absolutely. I always get my flu shot.
I know this COVID's going around. Ooh,
I'm not playing with
it's
that.
not doing too good. Have you had a tetanus shot in the last 5 years?
I don't remember.
Okay.
I think so.
You've been outside of the state in the last 30 days?
Mm-mm.
What about outside the country in the last 90 days?
No.
You had any surgeries?
Mm-mm.
No? Take the only medications you've taken in the past is some Buspar,
I currently take a Zyrtec every day.
Zyrtec. You take any other over-the-counter medications?
Mm-mm.
Okay. You're allergic to anything?
I'm allergic to Demerol
Mm-hmm.
and then the TB skin test they do.
TB skin test. What's the Demerol do to you?
It makes me itchy and it makes me swell up.
Oh goodness, definitely won't be giving you any of that then.
Yeah.
What's the TB skin test? Same thing?
Mm-hmm.
Or
Same thing.
have you ever had a blood transfusion before?
Mm-mm.
Any other kind of transfusions?
Mm-mm.
Alrighty. How would you describe your emotional state?
I'm pretty good
Good?
right now, yeah.
Alrighty. Just gonna ask you a few more questions. They want to know your life story over
Maybe
here.
I don't blame them.
So we're gonna go on to the obstetrical and menstrual history, okay?
Sure.
Do you see an OBGYN?
I don't have one currently since I moved.
Have you ever seen
Yeah.
one? You have?
Yeah.
Have you had a pap smear?
Yeah.
Any abnormalities?
Mhm.
No? Do you have a menstrual cycle?
Mhm.
Is it regular? Is it
Irregular.
irregular? When was your last one?
I just got off like last week.
Last week?
Yeah.
Was it pretty normal for your period? Or
Yeah, it was normal for me.
Okay. How would you say your blood flow was? Was it real? Was it a
Heavy.
lot? It's heavy.
Yeah.
Is it always heavy?
Always.
Always. What do you use? Do you use tampons, pads?
Tampons.
Okay. Alrighty. How's your diet?
It's okay. I've been eating a lot of fast food lately.
Okay. Better than eating out and going to the grocery store right now.
Yeah,
let me
it's
tell
crazy
you.
out there.
You do any exercise?
I used to go to the gym a lot, but not lately.
Not lately.
Yeah.
It's kind of hard to. Everything's closed
Everything's
down.
closed down. I'm not doing it at home.
I know I'm not. Do you drink any alcohol?
I'm a social drinker. I'm a drinker with all my friends, maybe a couple times a week if that.
Okay. No friends. What do you usually drink?
I'll drink beer, sometimes wine.
Beer and wine. How much when you do drink?
Not much. Maybe like a beer or two, or like a glass of wine or two.
Okay.
I can't do a lot.
Do you do any like home care, like self exams, like check yourself for breast cancer,
Oh, yeah,
anything
I do
like that? Okay.
I do that every month in the shower.
Tell me about your living conditions. Do you live alone with family?
I have a roommate. We live in an apartment.
Okay. You have any pets?
Mm.
Alrighty. Do you have any stairs that go up to your apartment?
I got a lot of stairs.
A lot of stairs.
We live on the 3rd floor.
Ooh, there's your exercise right
Right.
there, honey.
I'm getting
Ooh.
bringing my fast food upstairs.
Okay. Gotta do something. What do you do for work?
I work in the hospital.
A hospital? Are you a nurse? A tech?
I'm a tech.
I was a tech before I was a nurse.
Okay, cool.
Hard work. Very
Ooh,
much
I-
appreciate y'all.
Yeah, it's hard sometimes.
You having any environmental or travel exposure?
Mm-mm.
Talk to me about your family history, about your mom and your dad. They both still living?
Yeah.
Do they have any current health problems?
My dad is a type 2 diabetic, and my mom, she is hypothyroid.
Okay.
And she has lupus.
And lupus. What about your dad's parents?
My grandfather had lung cancer, and he died from it.
Your grandmother?
I don't know much about her.
Okay. What about your mom's dad?
I don't know much about him. But my mom's mom is hyperthyroid, and she had to get her thyroid taken out.
Okay. Do you have any, excuse me, do you have any siblings?
No.
Okay. Grandparents, they still living? Passed away?
My dad's dad passed away, and that's it.
So sorry to hear that.
Yeah.
What about your skin, hair, and nails? Any abnormalities there that you can notice?
Not really. Everything's about the same.
About the same? Has anything changed lately, or is just
No.
okay? Do you have headaches?
Mm-mm.
Have you had any like head injuries, concussions, anything like that?
Mm.
What about your eyes? I see you wear glasses. Is your vision good?
It's not that bad. My prescription isn't bad. I'm nearsighted.
Okay.
And I've only been wearing glasses for like a year or two.
Okay. Do you wear contacts?
Sometimes.
Okay. Do you have any pain or had any trauma in your eyes?
Mm-mm.
Do you take any eye drops?
Mm-mm.
No. Okay. What about hearing? Do you have any deafness, wear hearing aids or anything?
No.
What about having any discharge or ringing in your ears?
Nope.
You having any dizziness, having trouble like with your coordination or balance?
Mm-mm.
What about any like ear infections or anything?
I used to get them all the time, and I haven't had one in about a year or two, so
Okay. How's your smelling?
pretty good.
Good? Have you noticed that any smells that you can't smell or?
Mm-mm.
Okay. Do you get any frequent colds?
Mm-mm.
No. Okay. Any sinus pains, nasal drips?
I get that stuff like when the seasons change. Like
So-
I'll get seasonal allergies and stuff, but
Okay. Any having like any obstructions, any nosebleeds, anything like that?
I have a deviated septum.
Okay. You gonna fight with somebody?
Actually, no.
Your throat and your mouth, you having any hoarseness, sore throat, anything right now?
Mm-mm.
Any bleeding or swelling of your gums?
Mm-mm.
Having any abscess, any soreness, had any recent dental care?
No.
What about your lymph nodes? They tender, hard to touch?
No, they feel fine.
Okay. Having any trouble breathing?
Mm-mm.
You have to sit up at night when you breathe? Can you lay flat?
No, I lay flat.
Okay. Haven't noticed like any blueness or cyanosis around your nails besides your pretty
I mean,
nails?
I got navy nail polish on, but other than that, no.
Having any coughing, any wheezing,
Mm-mm.
spitting up anything, coughing up anything that's not supposed to be there?
No.
Throwing up any blood or coughing up any blood?
Mm-mm. I don't even remember the last time I threw up.
Any night sweats?
No.
Have you ever been exposed to TB?
Yes.
Yeah. Do you remember when?
A couple of years ago in the hospital.
And then you said that you were allergic to the TB since this.
Yeah, so they do the x-ray on me.
When was your last chest x-ray?
Maybe not quite a year, maybe like 10 months ago.
Okay. And did it show anything?
No.
Negative. All right, we're gonna go on to something a little more personal. We're gonna talk about your breasts real quick, okay?
Cool.
You having any pain, any discharge?
Nope.
Having any lumps or anything?
Nope.
And you said you screen yourself, right?
Right.
Once a month. You ever had a mammogram or anything?
No.
Okay. You having any pain like in your heart, blood vessels, maybe like in your arms, your legs, anything?
Mm-mm.
Having any heart palpitations?
No.
Any edema, hypertension?
No.
How's your exercise tolerance?
It's not horrible. It's not that great either.
Oh, look at me, honey. I mean, mine's not the best either. You had any tests on your heart? Maybe like an EKG, stress test, anything?
No.
Had any chest pains here lately?
Mm-mm.
No? Okay. Alrighty. What about any bruising? Any pain like anywhere?
No.
Okay. Any anemia?
Not that I know of. I haven't had my labs checked in forever.
Well, we'll check it while you're here. Make sure everything's good for you.
Alright. Better get one stick and done.
Hey, a good stick.
Okay.
A good stick. I'm 13-0 right now, so
Alright.
hopefully you won't be my 13-1. Do you have any abnormal blood diseases or anything that you know of?
Mm-mm.
You already talked about your appetite. How's your digestion?
It's alright.
You take any herbal supplements or anything for your digestion?
No.
You keep your food down when you do eat?
Mm-hmm.
Good. Having any heartburn, nausea, vomiting?
I do get heartburn occasionally. I'll just eat like a Tums or do some Maalox or something.
Alright. Does that usually help it?
Yeah, it makes
Okay.
it go away.
You throwing up any blood? Having any bloody stools?
No.
When was your last BM?
Today.
Today? Are you pretty regular? Have one every day, a couple times a day?
A couple times a day.
Okay. What color was it?
It's brown.
Can you tell me about what it looked like? Was it soft,
Okay.
hard?
It was soft.
Was it
It was
formed?
Formed.
Formed. Talk to me about the kind of foods that you like.
I don't like a lot of meat. I pretty much only eat chicken. Every now and then I'll venture into some pork. But as far as like red meats and stuff, I don't.
Like ground meat, stuff like that.
Yeah, I don't like that.
Do you have any dietary restrictions besides that?
Mm-mm.
You take any kind of supplements, maybe like protein shakes, energy drinks, anything like that?
I do drink energy drinks occasionally.
Alrighty. What about caffeine? I know those energy
I
drinks.
drink a lot of caffeine.
Okay. How much a month? I mean, well, how much a week? How many energy drinks you? Well, how many energy drinks you drink in a day?
Less than one. That's infrequent. I usually only do it when I go to work, so I'll maybe have like 3 a week, if that.
3 a week. Do you drink like coffee, soda, teas?
Yeah. I get my 300 milligrams a day.
Okay.
One way or another.
Do you have any heat or cold intolerance?
Mm-mm.
No. What about weight changes? Any unexpected losses or gains?
Not really.
Okay.
These quarantine snacks got me.
I know. They
I got
me
my
too.
5 pounds.
I know they've got me too. You having any abnormals like skin stretching, like abnormal stress marks, anything like that? Do you have any trouble when you're peeing?
No.
What about any like flank pain, pain above your pubis, anything like that?
Mm-mm.
Do you pee a lot at night?
No, like it doesn't wake me up, but when I do wake up, finally I have to pee like right then.
Okay. What colors are your urine?
It's like light yellow,
Yellow.
clear.
Do you having any edema to your face or to your lower extremities or anything?
Mm-mm.
Do you have any abnormal like joint stiffness?
Mm-mm.
Any pains in like your joints and your muscles?
No.
How's your range of motion?
It's great. We're fine.
Good.
I can move my stuff around.
Do you have any like abnormal swelling or stiffness, heat, any kind of like deformities?
Mm-mm.
No. Have you ever passed out before?
Yeah.
Tell me about that.
I was probably like maybe 14 or 15. I was really sick, like a sinus infection going on, and I passed out in the shower.
Okay. You ever had a seizure before?
Not that I know of.
Any kind of like paralysis, abnormal weakness, anything like that?
Mm-mm.
Any problems with your memory?
Mm-mm.
Okay.
Not that I remember.
I know. Definitely wouldn't remember. Do you have any depression?
No.
Any frequent mood changes? Having trouble concentrating?
Mm-mm.
We already talked about your anxiety. Any agitation?
Mm-mm.
What about having any thoughts of suicide or harming yourself?
No.
Ever had any suicidal thoughts?
Mm-mm.
Ever attempted to end your life?
No.
Tell me about your sleep pattern.
I'm awake all night and I sleep all day. So I'm kind of flip-flopped everybody else.
Is that normal for you?
Yeah.
For your job? Or?
Yeah.
Okay. Use anything to help you get around at the house, like a walker, cane, anything to help you do
No.
like your normal daily living?
It's all me.
Okay. Don't need any help doing anything?
Mm-mm.
Okay. You don't take any current medications besides that Zyrtec?
Right.
You take any over-the-counter medications or herbal supplements?
Mm-mm.
Okay. You have any questions for me?
No, I think I'm good. Do I sound okay?
Yeah, I mean, everything looks good on paper. We'll do a good, nice, thorough physical assessment. I'll have the doctor come in and speak to you.
Okay.
We'll go from there, okay?
Cool. Thank you.
Alrighty, you're welcome. If you need anything, let me know, okay?
Thanks. Yay!